Afternoon now. Good afternoon, everyone. I'm Dr. Terry from My Dental Care, Kota Damansara. Today, I would like to talk a bit on oral cancer. All right, signs and symptoms of oral cancer. Of course, I'm going to talk about the risk, the signs and symptoms, what is cancer, and what is oral cavity. All right, just a bit on cancer. What is cancer? Cancer is abnormal cells that divide without control. So it can invite the cells nearby the tissue or it distance away. Like maybe if it's from mouth, it can spread to other parts of the body. All right, through the lymph or the blood vessel. Okay. So oral cancer globally, there is 657,000 cases each year. All right. And according to WHO, in 2010, oral cancer is the sixth most common cancer. All right. So what is oral cavity? Let's talk about oral cavity a bit. I'm going to show you a video. I'm going to explain a bit on the oral cavity. All right. Can I have the...
This introduction to the oral cavity was created by Beyond 5 for the benefit of patients and families affected by oral cancer. The oral cavity, or mouth, contains many different structures. These include the upper jawbone, also known as the maxilla, the lower jawbone, also known as the mandible, and the gums and teeth.
The teeth,
the hard palate, inside of the cheeks, called the buccal mucosa. The area behind the wisdom teeth, called the retromolar trigone. The front 2/3 of the tongue.
All right, the tongue,
and the floor of mouth.
And what's below it is the floor of the mouth.
The oral cavity is important for talking, tasting, chewing, and swallowing food. The tongue is the most important structure for all these functions. If the tongue cannot move properly, then talking and eating can be affected greatly. This can be due to cancer infiltration of the tongue, of loss of tongue muscle or nerves after surgery, or scarring which limits movement. Cancer that starts anywhere in the oral cavity is called oral cancer. The most common symptom of oral cancer is an ulcer or lump in the mouth that doesn't heal. Some mouth cancers are painful, but most are painless. They can cause problems with chewing, swallowing, speaking, or difficulty opening the mouth. If the gums are affected, teeth can become loose or dentures may no longer fit properly. Another common sign is a white or red patch inside the mouth, which can be cancerous or precancerous.
Okay, yeah. So about the video, about it. And we're going to talk a bit on, I'm just going to explain to you, since you can see the video already, I'm going to explain a bit. All right, WHO includes pharynx as part of the oral cavity when you come to oral cancer, if you Google it. So pharynx in Malaysia, statistically, is the top 10. All right, I think it's the sixth most common cancer according to the new study published, right, in Malaysia. Okay, it's top 10 most. So male has the higher prevalence compared to female, probably due to habit. All right, what's the risk factor? A bit of nasopharynx. All right, it's not really related to oral cancer, but since WHO include it, we just talk a bit on nasopharynx. All right, the risk factors would be like family history. Okay, if your family has a history of nasopharynx cancer, you're higher chance to get it. All right, tobacco, alcohol. Right. So common signs and symptoms could be like numb in the neck, unilateral, means one side, hearing loss, any blocked nose, blurry vision, or numbness in the lower face. Okay. So what are the challenges in nasopharynx cancer is there's no specific program for us to screen it, and there's lack of awareness. So maybe if you have signs and symptoms, the patient didn't know that this could be a risky thing and they ignore it until it's a little bit too late. Okay. So let's talk about oral cancer. What are the risks of oral cancer? Right, tobacco. As we know, tobacco is carcinogenic, so there's a lot of chemicals in it that causes cancer. All right. And how about and alcohol? If you take alcohol and tobacco together, this will cause a synergistic effect, meaning the effects won't like add up, it will multiply up. All right. If it's multiply up, the risk of getting oral cancer is greatly increased. Okay. Excessive sunlight, especially for those farmers or those who does a lot of outdoor activities, remember to wear a cap, wear a hat, sunblock, right? And bitter nut, this is commonly consumed in the Indian community. It's consumed with bitter leaf and the areca nut or bitter nut. This is like a stimulant, all right, like coffee, but for them, it's a bitter nut. All right. Any irritation to oral tissues like sharp tooth that constantly causes ulcer, all these are the risks. Okay. And what are the signs and symptoms of oral cancer? All right. Maybe a few that's very common is non-healing ulcers for more than 2 weeks. This could be a risk of oral cancer, so better seek a medical attention. Any sudden changes in voice, any growth or lumps in the mouth, so it may cause ill-fitting dentures suddenly, or loose tooth, painful swallowing. Maybe there's a whitish and reddish patch on your tongue, on your oral cavity, anywhere. If you have seen any of these signs and symptoms, it's better for you to seek medical attention from the dentist or anyone. All right. Maybe there's systematically there may be weight loss. Okay, weight loss, very common for most cancers. Weight loss, loss of appetite. All right. So when you have all these signs and symptoms and you're worried, please seek professional advice from your dentist. All right. So what are the treatment of oral cancer? Okay, namely, we can do it surgical removal, where we will surgically remove the cancer tissues, um, radiotherapy, chemotherapy, immunotherapy, or targeted drug therapy. All right. So if you ask me which treatment is the best or which treatment is most suitable, this one is very subjective. You need to discuss with your specialist, all right, that will decide the best for you. Decide the best according to your condition, your cancer, staging, and like that, all right? So what can we do to reduce the risk? When I say about the risk, I didn't mean that um, if you practice all these bad habits like smoking, alcohol, you will only get. There are people who don't practice all these habits, but they still can get it. So what I can say is we reduce the risk by not practicing all these habits. Okay. Um, Wear sunblock, avoid bitter leaf, all right, avoid tobacco products or alcohol. But if you're a social drinker, maybe you just drink 2 drinks per day for male and 1 drink per day for females. All right. So this is about it. All right. Any questions from the floor? This is the end of the. Right. Thank you. If there's any questions, I can answer them.